6 months since a commissioner and 3 deputies were employed to manage the Southern District Health Board, they've just launched a new program aimed at getting feedback from past and present patients. It's part of an effort to increase community engagement, and Deputy Commissioner Graham Crombie joins us to talk about it. Good evening.
Hi Rebecca.
Tell us about the In Your Shoes program.
Well, In Your Shoes is part of a bigger program that we've got in play, which we released at the end of last year, called Southern Future. It's up to us, and that's about taking control of the future of healthcare in our region. The In Your Shoes bit is a part of a program where we're asking patients who've used our services to meet with our staff in groups of about 30 patients and 50 staff over a couple of hours period to talk about their experiences to help us understand better what went well and what didn't go quite so well.
And how do you expect the result of that to drive the organisation forward?
Well, what we're trying to do is allow our people and empower them to take control of the future. That's what Southern Future is about. And so understanding what has worked with the patients will assist our people in understanding what we should be doing better, what we can replicate and go from there, and what hasn't worked. Those are the things we need to focus on.
Why are you instigating more community involvement?
Well, I think all the research that we've looked at that says where things change and how these sort of organisations turn around when they've been in difficulty, it's about the individuals working for the organisation, our staff and our communities. So we need to connect with them and make sure that we're understanding the issues they're facing, and our staff can hear directly from them from there.
Is that your main focus this year?
It's one of several streams of focus this year, actually. In the Southern Future plan, there's 4 or 5 key areas. There's a piece around buildings and property that people have heard a lot about. So that's the new ICU unit here in Dunedin, some rebuilds, the training centre in Invercargill, and then the big clinical services building rebuild. There's a part of work around the health targets that we're required to deliver for our community, and so those are things like smoking cessation, cardiovascular emergency department, so there's a lot of work in that. There's a lot of work going into our systems, and so we see some IT come online in the near future that will help the connectivity of our patients with our people. And then there's a whole piece of work around the quality and our people itself. So new appointments, Chief Medical Officer, Chief Financial Officer, Communications Leader. So those key appointments to allow us to move forward. So plenty on.
Do you feel that you've achieved much in the first 6 months?
I feel I've achieved being busy from that perspective. Others will judge whether we've achieved much, but I think we have. I'm finding a really positive vibe with our staff and with the community. Everybody wants us to work, and so they're prepared to get in and work with that. And I think the building blocks that we're putting in play and outlined in that Southern Update plan, I think will set us in good stead.
Are you anticipating any common issues to arise from a consultation within your shoes?
I probably would sit back and wait to hear that. I think there will be common stuff. There's lots of interesting challenges we face in the southern region. So we are the biggest geographical group. So there's a whole lot of issues about how we get people from one place to another, especially in the middle of the winter when it's snowing and cold and the rest of it from there. So there's some challenges around that and distance. There's challenges around equity of access. But I'm also expecting to hear some really positive things, because most of the feedback I get from people who experience service in our health care are very positive. I mean, we have over 1 million primary health care interactions a year, and most of those are remarkably good. So a bit of both.
What's the process of working through the feedback once it's all collected?
It's going to be an interesting challenge, and we're working at that now, because we're pretty sure early on there will be things that can be fixed tomorrow that people have looked at and went, oh, that's just done, let's get on and do it. There'll be stuff that over a short period of time we'll take and work around and go with that, and there'll be longer term fundamental things. There's a second round for our staff in May built on the feedback from this. So we'll be going out with the feedback from this, going around and saying, did we hear right? Are these the right things to come from there? And then we'll be picking up with our leadership and our staff in May as part of building that into our plans for the future.
Southern District Health Board Deputy Commissioner Graham Crombie, thank you so much for your time.
Thanks, Rebecca.